The government has told us that lockdown is the most effective way of containing the pandemic. But it has been learned that what the government is informing us and what the government scientists are informing are vastly different. The ICMR, Indian Council of Medical Research, has told the government that imposition of a lockdown would result in a very marginal positive outcome. Even Dr. Vinod K. Paul of NITI Ayog and head of the government's 21-member COVID-19 task force, in a presentation to the government said that community transmission would continue in spite of the lockdown and that lockdown would not have much impact on the likely total number of infections. The government was advised by its advisors to use the lockdown period to prepare to fight the pandemic. The question arises, did Dr. Vinod Paul tell a half-truth to the government? On April 14th, while extending the lockdown till May 3rd, Prime Minister Modi had said two things. One, only 550 cases were reported in India in the first 21 days. And second, the government of India had taken swift action for which reason the virus did not spread much. The truth is that Dr. Paul did not tell the full thing to the government. The numbers which Dr. Paul was reporting to the government were a part of ICMR's private study. The ICMR in that study said that the total number of cases would drop by 40% if the lockdown is theoretically correct. And we know that the lockdown has not been theoretically right. People have been going outside. So, the ICMR revised its assumptions and dropped the 40% numbers to 20 to 25%. What the PM said was not true. In the first week of April, Dr. Paul of the NITI Ayog had told the government, based on an ICMR report, that the lockdown would not be fully effective and that it would bring about at most a 40% reduction in the number of cases during the peak time of infection and for all practical purposes a 20 to 25% reduction due to slippages. Dr. Paul even told the government to do a door-to-door checking of symptoms and keeping the symptomatic in community quarantine centers. This was going against the lockdown as no one was being able to go out during the lockdown and no hospitals were open. ICMR spoke differently to what the graph distributed by the government to the media on 11th April said. Its assessment said the lockdown was failing. ICMR said, 1. Despite the lockdown, the number of cases in Delhi, NCR alone would reach over 13 lakhs. 2. The lockdown would help postpone the peak time by 50 days. And 3. Quarantine the diagnosed and affected to break the chain, not impose a lockdown. The government's claim of community transmission not happening is unrealistic in itself. The government ignored what its own scientists told it. After the World Health Organization alerted the world in January and before India found its first case on 30th January, some ICMR scientists, collaborating with colleagues in other organizations, began assisting a possible India response to the COVID-19 pandemic. By the last week of February, they finalized two papers. One, a review of the situation, and another, the result of a modeling exercise. The important findings included: instead of a forced lockdown, a far more effective measure would be community and civil society-led self-quarantine and self-monitoring. 2. Lockdown brings with it long-lasting negative social, psychological, and economic impacts. 3. If 1 in every 2 who tested positive were to be quarantined within 3 days of developing symptoms, the total incidence could come down by 62%. Only on the 18th March did the government constitute the COVID-19 task force, which included some of the authors of these 2 research papers and headed by the NITI Aayog member Dr. Vinod Paul. But the government ignored the scientists' February recommendations. PM Modi imposed lockdown on March 24th with no scientific strategy in place and with a 4-hour notice which sparked a livelihood and food crisis among the poor and migrants. Even then, the lockdown was much delayed and exclusively for a political reason. The ruling party was looking forward to constituting the Madhya Pradesh government. The government was obviously thinking less before acting. Science was a casualty at the hands of politics. A part of the task force was to be blamed as well. The committee met again on 29th March, the meetings of frustration from the leading scientists because the government was not taking any concrete measures regarding the quarantine, testing and diagnosing. On April 6th, the task force constituted research groups to identify priorities and begin studies, including those for increased surveillance. Only more than a week after the lockdown began, in the first week of April, did the task force head suggest to the government through a presentation based on information contained in the research papers released way back in February that the best use of the lockdown period would be to buy time to prepare a scientific plan. Still unprepared for door-to-door surveillance and ramping up the rate of testing, the government extended the lockdown till May 3rd. By most estimates, the lockdown has been only effective in clamping down a much bigger spurt in cases. But for how long can you impose lockdown? For how long can you keep stuck in its tracks an already faltering economy, a result of the government's earlier decisions? Even after the late advice of the task force, the government deterred in taking crucial decisions on a large-scale testing and intensive surveillance. So what has the lockdown really achieved? And when will effective results begin to show? Inability to foresee the effects of its decisions remains the hallmark of this government, be it with demonetization, implementation of GST, or now imposition of lockdown.